Hi, my name is Aadhan. I graduated from JZMU. So I cleared this June FMGE with 237 marks, and one of the main reasons behind this success is the man sitting beside me, Dr.Harinath. So he has been a great mentor and a guide in these last 5 years. So he has been someone whom you can look up to. I have already said this, and I'm again saying this, that I can't imagine JZMU without Dr. Hari. So thank you, sir.
I want to start with the first question. So, can you tell what was the first feature to grasp you or to give you the attention to stick to this program?
So, to talk about this, I think I can't emphasize enough about the importance of practicing MCQs for this exam. So this concept of practicing MCQs was not there. This was not a part of our habit till then. And when in 2015 this app was launched, we were made to do exactly this. So we had to solve MCQs. This was a part of our semester curriculum also, because whichever subjects we are having in that semester, DMA made sure that we practiced MCQs related to that subjects. I can tell you this, first, at the first take, we were all scared to solve MCQs. We didn't like MCQs, to be honest, because reading the question, 4 options, and we were not used to that actually. So that's where exactly what DMA and Dr. Hari helped us. They in fact forced us. They made us do MCQs. So it was like giving a small dose, little by little, to a point where after a year or so, we are not at all scared about MCQs. We are so used to it. So when we were told that we had a test in the app, it was just a breeze. We would just go and we would know how to prepare and how to face the MCQs. So that, I would say, is the most important, the most striking feature of the app that attracted us and that made us believe in ourselves that even we could solve MCQs easily.
I should emphasize a point over here, and I read a kind of statistics in some articles stating that about 75% of the people who fail in USMLE are failing due to anxiety, but not due to any other reason. So when we started this program, we came up with this idea of desensitization. So when students are not shown or students are not exposed to MCQs or exposed to the practice of MCQs, they are always scared. And whenever you go and open the laptop or the app for the first time, and you get immense anxiety and you tend to fail. So the best way of coping up with such an anxiety is scientifically proved that it is the desensitization therapy. So we came up with a kind of psychological approach where we were giving slow and minor doses of MCQ exams. This is the initial stage. Then we started increasing the dose and difficulty with the time, where people were being exposed and they were decreasing their anxiety with desensitization. And it worked well, because in first attempt a lot of people complained and they started like failing. But once they start going through the system, later on they started feeling that actually it's not a big deal. We can just give the exam. So from technical point of view, we proved that this scientific approach worked. So once again, I'm emphasizing that this is called as desensitization therapy. This was the key tool, and this is the key feature of our application. When we started implementing, we already probed with this system, and we got a real good progress, I guess, with Dr. Aadhan at least.